Welcome to the Business Talk podcast. I am Deepak, your host for today's episode. It's a pleasure to welcome Dr. Dhiren Shah, renowned cardiothoracic and vascular surgeon and director at Marengo CIMS Hospital, Ahmedabad, as our esteemed guest on today's episode. Dr. Dhiren Shah brings over 20 years of experience and has successfully performed more than 17,000 open heart surgeries. Originally from Gandhidham, Kutch, he completed his MBBS and MS in general surgery from B.J. Medical College, Ahmedabad, and earned his M.Ch in cardiovascular and thoracic surgery from the prestigious G.B. Pant Hospital, New Delhi. Dr. Shah is the Chief Heart Transplant Surgeon and Director of the Heart Transplant and Mechanical Circulatory Support Program at Marengo CIMS Hospital, one of the India's most advanced and eco-friendly medical institutions, which he co-founded. Dr. Shah is a pioneer in minimally invasive cardiac surgery in Western India and has introduced several firsts, including Gujarat's first heart transplant, India's first hybrid CABG and TAVR procedures. First to do TransAortic TAVI of India. Dr. Shah has received specialized training in leading global centers, including Vietnam, Germany, the USA, and Switzerland in fields ranging from mitral valve repair to artificial heart and LVAD implantation. He is the Vice President of the Indian Society of Heart and Lung Transplantation and member of the Heart Failure Society of India, Joint Secretary of Society for Coronary Surgery. Dr. Shah leads a dedicated team of 7 surgeons, 4 anesthetic, 4 perfusionists, and 6 ICU specialists at Marengo CIMS Hospital, consistently performing over 1,000 cardiac surgeries annually. His areas of expertise include complex bypass surgeries, heart failure surgeries, valve repairs, and pediatric cardiac interventions. Dr. Dhiren Shah is married to Hetal Shah, an architect by profession, and is a proud father of 2 daughters, Dr. Navya and Uditi. In this episode, Dr. Dhiren Shah shares valuable insights from his medical journey on saving lives one heart at a time, the story of Gujarat's first heart transplant surgeon. So without further delay, let's welcome Dr. Dhiren Shah to the podcast. Dr. Shah, thank you for graciously accepting our request. It is a truly honor and privilege to have you join us today.
Thank you, Deepak bhai, and it's great pleasure and honor to be a part of your podcast. And I hope that this podcast goes well for and share some messages and some my thoughts process to the wider public.
Thank you, Dr. Shah.
Yeah.
Dr. Shah, can you take us back to the moment you decided to pursue cardiac surgery and eventually heart transplantation? What inspired that path, especially in a state like Gujarat, where no heart transplant had yet been performed?
I think so. It's a very interesting and interesting journey. But to start with, let me tell you, Elon Musk recently introduced this Neuralink. And I would say that that same Neuralink was already established way back in 1974 when I was born. So when I was born, my father, who desired to be a doctor, could not because of various reasons, said first thing when I was born that मेरे बेटे को मैं doctor बनाऊंगा. So this is joke apart, but yeah, there are certain things, certain events that occurs in your life. And I would say it has been widely accepted that your upbringing, your environment, your surrounding always defines your destiny or makes your destiny that way. So if we talk about 1970s and 80s, probably engineering was not a very big thing. India was still progressing. India was still making strides in the field of engineering and infotech and all. At that point of time, doctors were considered as the supreme thing. And when I was a very young child, 5, 6 years, 7 years child, at my home, my relatives I used to stay in Gandhidham. And then my relatives used to come from Bombay and they used to talk about that we got a bypass surgery done by so-and-so surgeon. He's a great surgeon. That person is very busy surgeon. He's just like God. So somehow, I don't know, but that all small things when I was just sitting there got ingrained into my mind. And probably at that point of time only, it was decided that I want to be a doctor and I want to be a cardiac surgeon. Normally what happens is majority of the time people, they enter into medical field, then they go for graduation, and then they go for post-graduation and postdoctoral. That is how their destiny is defined. But I was very clear when I entered my medical school that I want to be a cardiac surgeon. There was no other thought. So because of all that thing that had been ingrained in my mind, that cardiac surgeons are like God on earth. But it is not so. But yeah, the people, they feel that way, and that glorified that position, and that is how I got interested in cardiac surgery. And obviously after going into the medical field, the things evolved that way. So after doing cardiac surgery, I passed out in 2002 from JB Pant Hospital at the age of 28. So very few people have passed out cardiac surgery at the age of 28. Then started practice in Ahmedabad. So from 2002 to 2000, almost 12, 10, 12, I was doing routine cardiac surgery. And in that period of time, I was able to do majority of the works in cardiac surgery. I evolved over a period of time. It's an evolution in cardiac surgery also. Initially, you start with simple cases, and then you mature and you take complicated cases. But by 2010, 12, two things went into my mind, and the things were bothering me was a lot of heart failure patients, they used to come to me with an anticipation and with an intent, I would say, feeling that at least you have some answer for heart failure. Kindly treat my relatives for the heart failure. Is there any option for heart failure? So that was one thing. And second thing, obviously, by doing routine cardiac surgeries for almost 10, 12 years, 13 years, there was one that kick. I was losing that kick, and I wanted that kick now to do something different, or to do something exclusive in the state of Gujarat. So two things. In fact, there is a small story which really ignited this whole process of heart transplantation. One day I was in my OPD. Father of a 21-year-old young gentleman came and just touched my feet. Sir, mere bete ko kuch kar do. My son is really dying because of heart failure. Kindly do something for him. And at that time, I really decided, no, now it's high time that heart transplantation should be done in India, in Gujarat. Obviously, scattered cases were being done in India, but not much work was done on heart transplantation. Yeah, US was going in a very fast track, but we were still lacking a lot. So I decided to start a program in 2010-12. Went through the whole process of learning, observership, getting the teams together and everything. And that is how started the transplant program in 2016. December 19th, did the first heart transplantation of Gujarat. That was very few centers were doing at that point of time in India.
Very
So,
inspiring.
so it was basically a journey from the childhood and to do something. And second thing, I'm basically from Kutch. And we Kutchis, we always tell that we have that jigar, yeah, we have that guts to do anything because we have inborn genes of doing anything in life. So,
Very nice. Dr. Shah, pioneering Gujarat's first successful heart transplant was a landmark achievement that required more than just surgical skill. It demanded a robust ecosystem, from donors network to ICU readiness. How did you and your team overcome the medical, infrastructural, and emotional challenges to build the system and trust necessary to make this milestone possible?
I think it's a very important question. First of all, I would like to just point over here that transplantation, heart transplantation, is just not a surgery. It is not just like appendix surgery or bypass surgery or any other surgery. Heart transplantation is whole process. I would compare it with any of the startups. Everybody is aware of the system of startups right now. So when you are planning a startup, you need to create that whole system, whole ecosystem around that startup. So I think so when I started this thought process that I need to start the heart transplantation program. So obviously, first of all, I got myself ready. Then fortunately, my team was fantastic team with me, and I pitched that idea. Let us start the heart transplant program over here, and everybody said, "Fantastic, we are ready, and let us do it." So second thing was getting the team together. Then third thing was getting the knowledge, getting the infrastructure ready. So heart transplantation requires a lot of special infrastructure around in the hospital also. Fourth very important thing was the organ donation. Heart transplantation is one transplantation which is purely dependent on cadaveric transplantation. So until unless you don't get a cadaver organ donation, you cannot do a heart transplantation. And unfortunately, in 2015-16, the organ donation was not heard about in the state of Gujarat. Yes, there were few cases of organ donation, but not much. So in that environment, to have a transplant program was one of the biggest thing. So getting this organ donation drive, making even the government sensitized for this, that we will need a good organ donation program to start this heart transplantation program. So that was very important. And fortunately, in that period of time, I got a good support from the government also, which really started the promotion of organ donation and started various activities in Gujarat to increase organ donation. Fifth thing was getting the other infrastructure around ready. That is, getting the traffic police understand what is green corridor, because that is also utmost important. Sixth was a very important thing was getting the flights, which was one of the most toughest job in starting the program in Gujarat. Unfortunately, majority of the transplants, organ donation, they happen only in the middle of the night. And so you have to fly that organ because you have just 4 hours time. Once you remove the heart from one's body and implant it into other recipient's body, you have just 4 hours time. You cannot waste a single minute. So you need flights to transfer the organs from, say, Surat or Rajkot or Bhavnagar or so. So getting the airports ready in the middle of the night, majority of the airports are closed, getting small flights from the airport authorities, from the private players. So this was a huge task, which we really need. And that is for initial first 10, 15 cases, it was really very difficult to make people understand, make the authority understand this is required and I will have to do it. And gradually over a period of time, things got established, and then slowly infrastructure was ready. We got the license from the government authorities, and by October 2016 we got the license, and in December we were able to do the first heart transplantation. So heart transplantation is whole process. This was to start the program. Important thing is, when you do a heart transplantation, you need a multi-modality, multi-speciality team approach. You need a good pathologist, you need good hematologist, you need good infectious disease, you need good ICU care, you need fantastic nursing staff, physiotherapy, dietitian. So all sort of things needs to be changed. So if the training of everybody was there, we trained them, we made them sensitized about the transplantation program. And that is how we were able to start the successful program in Gujarat in 2016.
Every transplant story has two sides, the donor and the recipient. Could you share a particularly powerful story that stayed with you and perhaps changed how you view your work or life?
Again, very two interesting stories into this. So from donor perspective, once I went to harvest an organ from Surat, the donor was very, very, very poor, from a very poor family. Had a road traffic accident and a brain injury was there and was not recoverable. So declared brain dead. So when we were talking and the people over there, the Organ Donation Foundation, Donate Life, was talking to the relatives. Very poor people, very I would say sort of a beggar sort of family. But they had a huge thought process, very amazing thought process. They said that, sir, we are very poor. We don't have even our next day food also with us. In that case scenario, if by any means my relatives' organs can help, by I can donate my relatives' organ and they can give life to so many people, I would be really fortunate enough. So that was the thought process in that whole family. So that feeling of giving to the society, giving to the human being was amazing. And that really inspired that if there are so many people who are ready to donate things like this for the fellow human beings, and if I have that capacity and the system has that capacity to give that new life, why not do it? So that really pushed me to do more and more cases. And second incidence is the post-transplant patient. 17-year-old, very young, bubbly girl had COVID infection and had viral COVID myocarditis. She was in the hospital, in and out of the hospital for almost 6 months, practically in the hospital for 6 months for heart failure. We were trying to treat her medically, but unfortunately she was not recovering from the heart failure. So ultimately decided to go for transplantation. And you won't believe, after getting a new heart, the patient who was in the hospital for almost 6 months, after transplantation, on 14th day, patient got discharged. And right now that patient is doing fine. So that is the change that you can give to the life of people by this amazing technology, medical advancement that has occurred in the medical field. So again, these are 2-3 incidences which really gives you that motivation push that, yeah, let us do something for the society. We have to do something for the society.
Dr. Shah, organ donation is still a sensitive and often misunderstood topic in India. How do you navigate the ethical and cultural dimensions around consent, especially with grieving families?
I think so. This is a very important topic, and somehow now the government has also geared up, and there are now grief counselors in majority of the hospitals and majority of the government institutes also. Particularly, the civil hospital in Ahmedabad is doing amazing, fantastic work. They have a grief counselor. So what happens is, when somebody is sort of a brain dead, people start counseling them. Initially, we got a lot of resistance because of various myths that was prevalent in the society. But with increasing transplantation, with increasing media coverage of heart transplantation and organ donation, probably I would say in last few years, last couple of 2-3 years, organ donation has become relatively easier. But yeah, initially there were a lot of misconception. We had to really make them people understand what are the myths, what are the facts. Even I used to go around the society, gave n number of lectures about organ donation, why organ donation, what are the advantages of organ donation. So it's a process. So, and it is a multi-pronged approach, which as an individual, as an NGO, as a government officials, everybody has to take, so that the awareness increases and a lot of myths are broken for the organ donation.
Cardiac surgery is often regarded as one of the most demanding and taxing professional fields. How do you personally cope with its intense pressures? And why do you think fewer students worldwide are choosing to pursue a career in cardiac surgery today?
I think so, a very personal question, but let me tell you, cardiac surgery in the whole medical curriculum, cardiac surgery is one of the most demanding branch, and one of the branch wherein you need not 100% dedication and commitment, but probably 200% commitment. And against that, unfortunately, the returns are not so great. in the form of financial or in the form of family life and everything. So that's the reason why not many people are pursuing cardiac surgery right now. In fact, if you look at the number of seats, there are 180 seats across India for cardiac surgery. Almost more than 60-70% seats are going vacant. 60% seats are going vacant because, again, the demanding branch cardiac surgery is. Second important thing is the new generation which is coming up right now, the Generation X and Gen Z. They have a very clear thought process of work-life balance. And when you think of work-life balance, then probably cardiac surgery is out. I normally say whoever comes to take guidance from me for cardiac surgery, I would say, are you sane or insane? If you are insane, yes, then come for cardiac surgery. Otherwise, sane people cannot just pursue cardiac surgery because long hours of surgery, long hours of hospital stay, almost 24/7, you are working. In the middle of the night, you get calls. So it is a tough thing.
Beyond the surgeries, how has your work influenced cardiac care training or public awareness in Gujarat and beyond? What does legacy mean to you in this context?
See, in cardiac surgery, probably after we started the transplantation program, obviously, when you reach a transplantation program, you have matured to a certain level of competence in the team. And in the hospital also. So now we have reached a stage because of doing transplantation and managing heart failure patients, one of the most critical category of patients that you come across in the medical field. We are able to now manage very sick patients for even routine surgeries also. So even we are doing bypass surgeries with pumping of 15%, 20%, 25% also, valve surgeries. And so with that competence and with that competent team that we have at the hospital, it is easier to tackle this very difficult patients. So that is the level of competence now that we have achieved at our center at Marengo CIMS Hospital. And what has happened is now a lot of other surrounding patient wherein the people are not able to deal with that difficult patients, they pour in to our center and we operate that patients. Second important thing, what has happened is now a lot of new technologies are being added. In last 10 years, lot of advancement of new technologies there in the medical field. And particularly in cardiac sciences also, a lot of new innovations have occurred. So we are adopting that innovation at the earliest. And because of that adoption of innovations, we are able to give better outcomes. So a lot of new things. If you look at the field of cardiac surgery, probably 10, 15 years back, and if you look at right now, there's a vast sea change in how the surgeries are being performed in the state of Gujarat. Yes, it is everybody's contribution is there, but yeah, it is over a period of time the things have changed and the acceptance level in the society has changed significantly. And I personally feel, as you talked about legacy, my goal, my dream has always been that I want to leave behind a legacy of something in after I die or after my career is over. I should have some legacy behind me. See, ultimate goal of any person is just not living all alone or just spending their own life, but giving back to the society, sharing the knowledge that you have acquired over a period of time to the next generation. So next generation is better off. They are far smarter than what we were. And creating an environment in the state so that people feel secure that if anything happens to me for the cardiac issue, yes, in Gujarat, we will be able to do. So that sort of legacy, I really am, I have that thought process that I want to leave behind. And hopefully I may be able to do that over a period of time. But yes, that is the legacy. And I've read Swami Vivekananda, and Vivekananda has very rightly said, the goal of your life is not happiness, but goal of your life should be acquiring more and more in knowledge, more knowledge and more knowledge. There is nothing there in the life. You have to go on acquiring knowledge and sharing the knowledge. That is the goal of life and not the happiness, which unfortunately the new generation is just behind that happiness. That is not going to give you happiness. What is going to give you happiness is what you are giving back to the society. That givingness gives you happiness.
Very nice. Dr. Shah, my last question. What's next for cardiac care in India and for your personal mission? Are there technologies like AI, robotics, or partnerships or areas you are especially hopeful about in the near future?
Yeah, with the increasing number of complexities that we get and the very complex cases that we are getting, and with high expectations from now the patients also. Initially, I know when the patient used to have heart failure, people used to just pray to God, "Ke ab Bhagwan bharose," and take few medication and wait for your death. But now with advancement, people are having high expectations. And with that high expectations, more responsibilities are there on the shoulders. So what we have done is we have tied up with a lot of medical technology systems. So one of them system is the remote remote monitoring system that we have introduced in the state of Gujarat, wherein patient is sitting somewhere and I can monitor that patient pulse, BP, saturation, blood pressure, everything I can monitor from my place or from a central command center. So that is how you can manage the heart failure patients from distance. So remote monitoring is one thing that we have introduced. Second important thing is the holistic approach of the treatment. That is, it is not just the surgery and sending the patient home, but creating a post-operative care of the patient at home also. So remote, I would say again, remote rehabilitation programs we have started so that patient at home also gets rehabilitated nicely, so the recovery is good. Third, we have tied up with IIT Gandhinagar to come up with some innovations so that can help the patients. We can come out with some innovative ideas. We are in process with 2-3 innovations right now. Probably if that gets successful, then probably we may it may be a very life-changing things for the patient also. So again, we have tied up with IIT Gandhinagar for the medico engineering tie-up and creating something new, the way that Stanford and Harvard has been doing since years. So that has been there. Other lot of collaboration with the societies across the world and getting new things to the state of Gujarat. The robotic surgery also we started almost 6 months back. So robotic cardiac surgery is an area wherein we started that robotic surgery 6 months back. So that is an area which is going to explode in coming future. Minimally invasive cardiac surgery is an area which a lot of people are talking about now. I started way back in 2010. Since then, I have been doing minimally invasive cardiac surgery. So that is the future of cardiac surgery. Then TAVI is the without surgery you can replace the heart valves. So that technology also we started in 2015. In fact, I did the first TransAortic TAVI valve of India in 2015, and that patients survived for over 6 years. So that technology is also there now in the state of Gujarat. So a lot of new things are on the horizon. And we are hoping that probably in coming future, cardiac surgery will become just like any other any other surgery, daycare surgery. Patient getting admitted in the morning, getting discharged next day morning. That is the dream. So that they don't have that fear of open heart surgery. That fear of open heart surgery is still there in the society. And we want to break that fear. And people should have that feeling in their mind, in their heart, that if anything goes wrong with the heart, at least there is something, some hope that something can be done for that heart.
Listeners, what an incredible journey we have explored today with Dr. Dhiren Shah, surgeon, pioneer, and visionary. From performing Gujarat's first heart transplant to transforming cardiac care in Western India, Dr. Shah's story is a powerful reminder of what dedication, innovation, and compassion can achieve in the field of medicine. His commitment to advancing heart surgery, building world-class infrastructure, and inspiring the next generation of surgeons is nothing short of extraordinary. It's not just about saving lives, it's about changing how we think about healthcare, possibility, and progress in India. Dr. Shah, thank you for joining us and for sharing not only your milestone, but also the heart behind your mission. We are honored to have you head on the show. Thank you so much, Dr. Shah.
Thank you, Deepak Bhai, and it was great honor to be part of your podcast. Thank you very much.